There were 863 locally acquired cases of COVID reported in the 24 hours to 8 p.m. last night, 3 overseas acquired cases, and 120,281 tests were performed. There are currently 1,082 COVID cases admitted to hospital, with 212 people in intensive care, and they span the age groups. In terms of the suburbs of concern, we still want to, whilst we are pleasingly seeing declines in case numbers, particularly in southwestern Sydney and western Sydney, they're still starting from a very high point. So some of the areas of concern still remain: Greenacre, Marylands, Guildford, Yagoona, Blacktown, Minto. But we see the increase in cases in the Illawarra and Shoalhaven, particularly about that Wollongong and Shell Harbour area. And also we're concerned about Mount Druitt and Auburn. The key message is that we also are seeing some regional outbreaks, and Minister Hazzard will provide more details about the regional situation. Sadly, I have to announce the death of 15 people today, 7 women and 8 men. 2 people were in their 40s, 2 were in their 50s, 4 people were in their 60s, 3 people were in their 70s, 1 in their 80s, and 3 people were in their 90s. 1 person had received 2 doses of the COVID vaccine, 5 people had received 1 dose of the COVID vaccine, and 9 people were not vaccinated. 5 of the people were from southwestern Sydney, 3 western Sydney, 1 person was from Newcastle, 1 person was Lake Macquarie, 1 person was from Sydney's inner west, 1 person was from southeastern Sydney, and 1 person was from Sydney's eastern suburbs, and 1 person was from Dubbo, and 1 person was from Batemans Bay. There was a gentleman in his 40s from Western Sydney who died at Nepean Hospital. He had underlying health conditions and wasn't vaccinated. And the 2 people from southwestern Sydney who died acquired their infections at Liverpool Hospital, a man in his 60s and a woman in her 90s. And 2 people died at home. There was a lady in her 70s from Batemans Bay who died at home, had received 2 doses of the COVID vaccine, but had only just received the 2nd dose shortly before her death, and she was diagnosed after her death. And then there was a gentleman in his 40s from Lake Macquarie who had underlying health conditions. In terms of sewage detections, New South Wales Health's sewage detection program has indicated positive test results from Dareton in the far west. Now, there is a possible source of someone who's resolved the infection, but as you know, you can shed for a period of time. But we are still wanting that community to be on high alert and get tested. South Grafton in the Northern Rivers region, we have no known cases, so we do want the community testing rates to increase there. Jindabyne did trigger in the sewage, and we have identified a case overnight in Jindabyne, but again, please be very alert in that community and come forward for testing. And Maruya on the far south coast, to date we have not had a known case. I would like to urge everyone to get vaccinated at this time. So if you are still unvaccinated, please, there is increasing supplies of Moderna at pharmacies, and GPs have strong supplies of Pfizer. So anyone over 12 years of age, regardless of your age, please go forward immediately, book in an appointment and get vaccinated.